A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello, Jagoda. So lovely to see you. Thank you so much for joining me today. How are you?
Thank you, Mary. I'm very good, thank you. How are you?
I am good. Just really enjoying this summer English weather. So from what I understand, you are a Polish homeopath living in the UK and around Europe. Is that right?
Yes, I did a little detour from UK at the moment. So I lived in El Hierro, which is one of the Canary Islands, for over 3 months. And currently I'm in Portugal. So I'm on a little tour.
Fantastic. And before homeopathy, I understand you were a pharmacist.
Yes, so I graduated from the pharmacy back in 2009, and I worked a couple years back home. But I really wanted to come to UK, which I did in 2011.
Mm-hmm.
And at the time, I started in a conventional Western medicine pharmacy, working as a pharmacist and trying to find my way around it to get a feeling that I'm really helping patients. But I didn't sort of get that feeling, and I moved to hospitals. I worked in general and I worked in oncological hospital as a pharmacist for a few years, and I still didn't see myself as helping patients in the Western medicine world. And back in 2017, beginning of that year, I decided to take a career break to sort of rethink what I can do with my experience as a pharmacist, but actually maybe try something different and help patients in different way. And I started looking into different colleges with natural health, and some of them were offering like herbal medicines, iridology, and homeopathic came also as one in a couple of them. And then I thought, okay, homeopathy, that sounds familiar. And I started reading about it. I bought my first book at the time. It was a guide to homeopathic prescribing by Dr. Loki. And I thought, okay, if I'm going to read that book, and I still think that this concept of treating patients or medicine is something what I want to do, I will join the college. And that's what I did. I joined the college, and that's how my homeopathic journey started. And it also, in a way, I continue my pharmacy role in a way, because I was really keen at the time. I really wanted to learn fast. And
Mm-hmm.
I was like, where will be the best place for pharmacists to learn faster? And obviously, as a pharmacist, I thought, okay, let me apply to the 3 biggest pharmacies, or the only one I knew in London.
Yes.
And so I sent my CV asking them, can you take me as a volunteer? Can I shadow someone there? I just really want to put my hands on homeopathy. And luckily enough for me, one of them, which is Ainsworths, was looking for a pharmacist at the time. So I went through interview process, and they took me on board, and I will be always grateful for that opportunity, because I was fast track in a way with my learning process, studying in a college at the same time as working there as a pharmacist. I was really scared at the very beginning, because I thought, I don't know anything. I was so clueless. But you just you just learn every day, and we never stop learning as a homeopaths and pharmacists as well. So I just was really keen and really determined, and yeah, it was a great experience to work that way at the time.
Fantastic. Well, like you say, such a fantastic opportunity, and it meant you were really double barreling there. You were learning both sides of the coin. So how did working with Ainsworth differ from working with a Western medicine pharmacy? Because the whole structure, everything about it must be quite different.
Yes. Well, as a pharmacist in UK, you mainly focus on the symptoms, yes, and often it might happen that one symptoms being treated with the medicine may cause side effects, and you actually prescribing another medicine to counteract that side effects. So is purely focusing on the physical symptoms or symptoms alone, yeah, because if there are some, let's say, mental symptoms, they wouldn't be taken in consideration with the physical symptoms. They will be treated separately to the physical ones.
Mm-hmm.
So that's what, unfortunately, Western medicine might be missing the link between the symptoms, where as a homeopath and homeopathic pharmacist, you kind of trying to link the symptoms. You try to find the connections between them. You try to find the causation of them to know where the symptoms started and what's the connection between them. And working in a pharmacy, it shows a lot, because a lot of patients, they translate Western medicines to homeopathy, trying to understand it. But obviously, it's different concept. It's sort of going a little bit like a detective, yeah? Homeopathy is like a detective. They want to know what happened and how does it feel? What's the sensation? It's not just I have a pain, yeah? Where in the homeopath, in the conventional Western medicine pharmacy, you would just say, "Oh, you have pain. Okay, this is painkillers you can take."
Okay.
But obviously, we have so many remedies which can work on pain, and all of them have their specific modalities, specific picture, and everything what it takes to choose the right ones.
Mm-hmm. Okay, so, and also just explain, because I really don't know how normal pharmacies work, but Ainsworth obviously makes remedies from scratch and then bottles them up and sells them as well. But as a pharmacy in a Western medicine and a normal pharmacist or a hospital, are you actually making the medicines, or are you just buying them in and repackaging them and giving them out?
They simply they are bought from wholesalers in a Western medicine, and you sometimes unpack them and distribute them to something called blister packs.
Okay.
Easier for patients to take dosage of the medicines for a day, or for morning, lunchtime, evening, depending how many times they need to take medicines. But you do not manipulate medicines. Back home, on the other hand, we still do handmade medicines in a Western conventional medicine pharmacies.
Yeah.
So you still do specifically designed for the patients. In UK, this kind of special orders are made by laboratories. So there might be pharmacists who is involved, but this is not in a conventional setting, open setting, or in a hospital. It's a special laboratories where this is done. But yeah, the medicines mainly are just from the packets as they come from the wholesalers.
Okay, so quite a different job. So when you were in Ainsworth and obviously employed as a pharmacist rather than as a homeopath, and presumably that changed halfway through your training, but tell me, what was your role in Ainsworth then?
Well, as a pharmacist, you involved in each stage of the process. You can provide advice to the patients who come. You can you can prescribe them remedies or suggest them remedies, and if they are happy, you prepare them as well at the spot. But also you oversee work of others. You look at the prepared remedies, because before they are dispatched by post, we need to make sure that the content, the presentation, the expiry date, and other things are correct. And that's where pharmacist skill comes to play, where attention to detail is important. Because as a pharmacy, it follows the regulations of the pharmaceutical society. So it requires sort of attention to those things. And after that, you basically making sure that the orders are done, and they are, as soon as possible, are sent to the patients. So it's kind of rounded role. Obviously, as a pharmacist, you have specific tasks as well. Often you get inquiries from patients who are on allopathic medicine and they want to try homeopathy. So you want to see if any of their medications might actually interact with homeopathy. And we always think, oh, homeopathy is safe, and it is safe. However, there are certain circumstances, and one of them is when patients are on the blood thinning medicines, that they shouldn't be taking certain remedies. And very well-known remedy is arnica. So arnica is a great remedy for bruises and is often used around surgeries. But if someone is on the blood thinning medications, and it's not aspirin like used to be, but there are medications of very exotic names like Pradaxa, Clopidogrel, there will be a mistake to give them arnica because it might increase their actual bleeding.
Yes.
And surgeries, especially orthopedic surgeries, even patients who are not continuously taking thinning blood medicines, they might be put temporarily on them when they have a hip replacement or knee replacement. And then we should always ask. So the pharmacists need to be vigilant in that cases and oversees the interaction and speak with patients who are having multiple medicines to make sure that none of them will be affected by what they want to use from homeopathy.
Okay, yes, I understand. That's very important.
Yeah, other things, maybe some simple things like diabetic patients, they really, some of them, they might be really sensitive and they shouldn't be really using pill form of the remedies because it's sucrose.
Okay.
So for diabetic patients, we would recommend to take them in a lactose form, for example. Where on the other hand, someone who is intolerant to lactose should not take tablets because they are made of lactose.
Yes.
And we would suggest maybe pills or liquid form. And then when it comes to babies, which often is the case when moms starting homeopathies during their pregnancy or for their babies, the liquid form would be the one which you think, oh, it's the easiest one to give to child, but actually it contains alcohol, even is some tiny amount, but and you can easily evaporate that alcohol. However, saying no, it's probably better just to crush the pill and it will be the same effect is often the thing. So yeah, as a pharmacist, you have few things to oversee as well. There are certain plants and certain tinctures which actually are listed as a poisonous because things like Atropa belladonna or Nux vomica in the tincture form before it becomes diluted to the potency is actually a poison. So it cannot be sold or given in a very low potency, or it cannot be given as a tincture. So also getting prescriptions for certain things like that when the doctor is actually wanting to give such a high percentage is important. So then the pharmacist looks at those prescriptions as well.
Okay, that's interesting. So so you're involved with every aspect really of the remedy production right through to sending out.
Yes, you are, and it's quite rewarding because you can really see the process, how you can help at each stage, and how, I mean, obviously the manufacturer side produces remedies on a bigger scale. We just in London we're doing on a small scale, needing the bespoke remedies for the patient orders, not preparing massive amounts.
Yeah.
But yeah.
Okay. And so explain to me as well, because I know that in the UK, our pharmacies have got specific remedies which are licensed. And from what I understand, and correct me if I'm wrong, but to license a remedy, we have to say, okay, this remedy is good for this symptom, which of course most homeopathy, that makes it very difficult. But for some of the first aid prescribing, we have regulated some of those remedies. Is that correct? Something like arnica, we can say it is for bruising because we have got that licensing with the pharmacy.
I think it's more to do with if there is enough studies which shows actually that this is how it works. Because when the law changed, all of them, they could have, not maybe all of the remedies, but some substances could have their indications stated. But there could be a case that there wasn't enough studies which show that in a form they expected. But yeah, arnica is a very well-known substance, so it has its indication, I think, on the packaging. So
that recommendation. Okay.
Yes.
Okay. And I understand that you, whilst you were at Ainsworths, you were able to try some of the new remedies. Tell me a little bit about that.
Yes, we often try some new remedies which were either made in our pharmacy or sent to us from other homeopaths. And I remember one occasion when I tried one of the new remedies of Martin Mercy. She's a French homeopath, and she has a big collection of the fossil remedies. And she sent to us, just beginning of the pandemic, she sent to us a remedy called Oliva Sayana, which was a remedy she made when the actual pandemic started. And I kind of get a interesting experience with it when half of my body, there was some lightness, also some tingling in it. So yeah, we often would try different remedies to see on us, not official proving, but just to see how we experience them. And yeah, sometimes there was interesting effects of that. Yeah.
Yes, absolutely. Because of course, that's how Hahnemann tested remedies, wasn't it? On himself and his family. So that's really what you were doing with the remedies as they came in. Yes.
And if you want to know more about remedy, that's how you learn. So.
Okay. What you're feeling as a fit and healthy person.
Yes, because obviously for the new remedies, there is no yet materia medica, so it's going to be with the time needed for many people to try them. But your own experience, I think, is important as well.
Yeah. Okay, brilliant. So tell me, what are your 3 most favorite remedies and why?
Well, I was thinking about what are exactly my free remedies to point. Often people ask this question, what are your favorite remedies? And I think I like more than 3. And a group of remedies I really like is Bowel Nosodes. The Bowel Nosodes are quite interesting in the respect that they correspond with planets, as well as the patient types. And what I find that patient requiring specific bowel nosode would require the remedies which are in a connection with that bowel nosodes, and vice versa. Sometimes someone who would need some remedy would need that bowel nosode as well at some stage because of specific either mental or physical symptoms, and especially in patients who are having sometimes skin problems or bowel problems, and yes, so that would be one of the groups I really like. And my first aid remedy, which I really like, is Aconite, and that's something what I always tend to have somewhere for some things what can develop suddenly and very fast, and it can be fright, shock, it can be anything, sudden experience of colds,
Yes. Yeah.
which helps to stop that cold to develop further. And probably another remedy which I often use on myself or tend to have somewhere is Ignatia. And that could be, I don't know, if there is some moment of emotional distress or some sadness. And then if you cannot sleep, that would, a dose of that remedy often saves me in a way. So yes, that could be my first 3 favorite things in homeopathy, I would say.
It's so difficult to choose, isn't it?
Yes, so many. And at various points, you attach to some, or you're studying some. And I remember when I had the moment that I really was studying fossil remedies, I really like idea about, actually was not a fossil, but was the Agglestone. So there are moments in life when certain remedies becomes closer to you for different reasons.
Yes. So tell me, because I know that you've been on quite a journey. Has homeopathy changed your life? Has it changed your aspect, your outlook about life, the way you live, any aspect of life?
Definitely, at the start of my journey with homeopathy, my life also has changed. I definitely, before I was aware of certain things, but start paying attention more to those things when I started to study homeopathy, and those things like diet and exercising and things which can help your body to go back to balance more easy. I started doing yoga 5 times a week. I study Tai Chi as well to help some grounding, because it's the best way to deal with your emotions and certain things which you're experiencing is at the time when you leave them, and then they start progressing to physical symptoms, they might be more difficult to kind of treat, but preventing them to accumulate is the best way. And by healthy diet, better sleep, as well as doing exercise and grounding, you can actually keep yourself in balance. Obviously, you sometimes need some checks and twists, but this helps you to stay in a balance in a way. So all of these things happen in the past 5 years for me, and I keep doing them. I obviously have moments that I might not do them as frequently as I want, but I try to stay on that path as much as I can.
Perfect. It's so lovely just talking with you, because obviously, when I see your posts and see what you're doing and traveling and visiting islands and all sorts of things, it seems, you have such a lovely life, and then we can just get together and talk about homeopathy. It's just absolutely perfect. It's been so lovely talking to you today. Thank you so much for coming on.
Mary, thank you for having me.
Yeah, lovely. Thank you. Thank you, Jagoda, for coming and joining us today. It's been really, really interesting to learn about your journey from pharmacy into homeopath, and now hopefully homeopath pharmacy as well in the future. Maybe we'll see that one day. Next week, we will be talking to Kiera Corcoran, who is also one of our Homeopathy 24/7 homeopaths. Kiera is going to be talking about intuition and following your gut instinct. So important for homeopaths and for you as a self-prescriber as well. It's a skill that we need desperately to relearn. Look forward to seeing you there.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.